A broken bone is also known as a fracture. There's a common misconception that a broken bone is worse than a fracture. In reality, they're the same thing. There are many different types of fractures or breaks. A bone can be broken and the fragments can be out of position. We call this a displaced fracture. Conversely, if they are in good alignment, it's called a non-displaced fracture. If a bone is broken and you can barely see it on X-ray, it is a hairline or stress fracture. Finally, if a bone is broken and one of the fragments has punctured through the skin, we call this an open or compound fracture. Since open fracture can easily become infected, immediate surgical management is required. Broken bones are usually splinted initially to prevent bone movement and further damage to the soft tissue that surrounds them. If the fracture is displaced, it may need to be set. In certain fractures, setting can be difficult. In these types of fractures, surgery is also indicated. This will provide the best opportunity for healing. Even though all this sounds very scary, most fractures can be managed in a cast without going to the operating room. Even simple fractures of the toes respond very well to this treatment. And yes, we do put cast on toes. Not the plaster or fiberglass kind. Instead, we use a mesh tape which holds the toe in place. If you or someone you know has sustained an injury to the foot or ankle, we'll make every attempt to see you as soon as possible.